Good morning, everyone. This is the Revised MnCHOICES application launch webinar for Wednesday, April the 12th, 2023. Welcome to today's call. This screen or this slide shows the people who are in attendance with me today to provide you support. As you know, this session is being recorded. You heard me announce it at the beginning. We will use WebEx. You can use WebEx audio to listen to this session. All the participants are muted. We'll have you raise your hand to ask questions when it is time to ask questions, and then we will call and unmute you so that you know. So I just want to continue to set some ground rules and to provide some acknowledgement here. The launching of a new computer application, we all know, can be stressful. And as we move forward and we provide you support as these last few weeks into pre-launch and then into post-launch, I want to just make sure that we continue to foster an atmosphere about good intentions and respect. Because the DHS staff is here really to provide you information and to support your agencies during launch. We know that you're attending so that you'll learn and ask questions and be able to answer questions back at your agency. So we really want to continue to foster that sense of good intentions and respect going forward. Oh, and then, sorry, and at the bottom of the slide, if you do have concerns, I would ask that you raise them on the help desk form. That way we can collect them, provide them to the appropriate folks within our agency who then can respond back to them. So as you know, our objectives for these webinars are to make sure you can understand and communicate the release schedule, content management changes to your agency as well. Learn about the tool in the computer application so that you can complete your work in the field, share workflow, and ensure handoffs. That's part of what we will do today with talking about transfers, discharges, and assignments. And then to make sure that you can apply your knowledge and that your users will be able to apply their knowledge to the application's functioning, kind of to inform your workflow plans as well as you move forward to launch. And then also to implement the transition timeline and using the historical documents that will be provided to you to facilitate the transition. And lastly, our last objective is to update staff member data to implement user access at launch. We have that done and in place, and as well as we have a procedure to help you do that on the day of launch and after. So we would like to start today's webinar by inviting Mary Leonards to speak. She is our manager. She works in the Disability Services Division and does work with MnCHOICES. So Mary, if you can be unmuted. You are available to speak.
Hey, Mary, I see that you're unmuted.
We'll just wait a moment longer. We all know sometimes that double muting causes problems that we didn't expect.
Can you hear me now?
We can.
Okay, I think I had my muted on the other thing. My apologies, everyone.
That's okay.
I was talking away to myself. So hello again, I'm Mary Leonards. I'm happy to be here with you all today. I wanted to just touch on a couple of key things that likely you know about, but want to make sure this group has heard. Most importantly, we sent out an e-list last week saying that DHS is pausing the launch of MnCHOICES revision. This pause is allowing us time to finalize our post-launch plans and to most importantly respond to the feedback from lead agencies that we've been gathering as we prepare for launch. So we're taking that feedback. We're considering adjustments to the partner advised rolling launch schedule. And I also want to know we are aiming to launch still within 60 days with the revised schedule and rolling launch plan. In the meantime, we will continue to hold office hours, pre-launch webinars like this one as planned because there's lots of information to cover and we want to make sure to maximize any time we have with you to help you be most prepared. We will also be communicating at a regular cadence, just like we've been doing out through this project. So on Fridays, E-List, we said you're going to hear more by the end of this week, which you'll have something out this week with a bit more information. And then we'll continue on a maybe 1 or 2 week cadence, depending on where things are at, just so that even if there's not a lot new, you at least know that we've communicated and that you haven't missed anything. Another piece I just wanted to touch on about this specific webinar is, where this is about reviewing the content of the version 3 of the current functionality document that was just released in the last days. And I just wanted to remind us all that this is a point in time document, right? It's a living document. We capture everything that's current and we put it into this document to help you know what are some issues, what are things that you might have to do while we wait for them to be resolved. And it's also a place where we add new things as they're discovered, right? So be patient as we know it's a point in time. An example of this version does include a few newly identified workarounds, which the team is going to talk about. So yes, there's some new things in here. And however, it doesn't remove two issues that were resolved last week, right? So there were two case mix workarounds that were resolved last week. So they're still in this version, but if you have it in front of you, scratch it out for now. Otherwise, we'll be working on version 4 for you guys. And those two that we resolved were those kind of really important ones to lead agencies, right? Around case mix and eligibility. So we're excited that those are already taken care of. And finally, I just want to say thank you for your time, your attention. These kinds of large system launches are challenging for everyone, even in the best of times. And we just want to acknowledge you all as the primary users of the system, are the most important parts of making this launch work. So just wanting to acknowledge that, we've heard relief because we're pausing. We've heard frustration because we're pausing. And we know we can't make everyone happen, but we're trying to, really just have the most solid plan that allows everyone to move forward together. So thank you for your transparency. Thank you for your feedback. We understand if you're frustrated. We're doing our best to work forward. And finally, I just want to also say to this group or remind this group that we have developed a whole governance group for MnCHOICES, which is called the Systems Governance Group. And then it has a component part called the Input Group. And these two groups together include DHS staff, Minute staff, and most importantly, lead agency representatives. And that's the group that's really looking at the details of each of these issues, understanding the impact, what it takes for if it's a workaround or those things, and helping us to prioritize what gets fixed in what order first. So just know that we come here, we say, we care, we listen, please share, and know that there's a lot of ways that we've built our system to get ongoing feedback from you all because we know how important it is. So just again, thank you all for being here. I'll turn it back to the training team now.
Thank you, Mary, very much for providing the update today. So a couple things I wanted to revisit, and that neither Mary's slide or this slide are in the PowerPoint that was provided to you because they were added after we had submitted it, the PowerPoint into TTC. But I've heard some people having concerns that they're not getting all the emails. And so if you are on the email mentor list, you are getting everything that is coming through our through that process. We had a short bit of time for the office hours announcements where we were having an issue with the help desk email, and that has been fixed, so you should continue to get those emails that you're used to seeing from them. The other place to get information that you heard Mary talk about today is the e-lists that are going through the disability services e-lists and the aging and adult services e-lists. And so I just want to show you a little bit about how to subscribe, and then also talk about the links and how they're used, and then where the archive sits. So let's go through and do these one at a time. Let's start with how to subscribe, and I will bring up my Microsoft Edge, and then I will show you that just to make sure that you're aware of it. So if you're not sure you're getting everything, you know you're not getting e-list, for example, then I'll show you how to do that. So where I'm going is I'm going to MnCHOICES County link because we added the subscription e-list on the MnCHOICES revision project page, so I'm going to click on this link so you can see it in blue highlighted. And then you'll see underneath the heading MnCHOICES revision project launch information, subscribe to an e-list. So that's right here. Whoops, sorry. And then after it, it says DHS listserv subscription page. And so you'll click on that link. And then there's a whole list of email subscriptions. And the one you want to go to is the Disability Services Division Lead Agency e-list. Okay. So by clicking on the plus sign, you will see the Disability Services Division e-list. There'll be a bunch of information that you can go ahead and read. If you determine, yep, that's the e-list I want, this is the e-list that we're communicating MnCHOICES updates through, then you add your address and hit submit so that you are aware. And then I want to show you this next piece. I have a bit of a concern that maybe people aren't reading any more than just the e-list information that they get, and every e-list comes with a link, okay? And the reason why that link exists is in some cases the link is just basically the e-list that you just saw, but sometimes it's a much expanded message, and I want to show you an example of that. So this is a message that went out on March 28th at noon, okay? And it is the one that, so you can see update on the launch of the revised MnCHOICES application. This is the one that said, hey, the delay will be till approximately April 10th. But the reason why I picked it is not to cause confusion with you about which e-list, but to show you this. When you click on this link that's in here in blue, it says for further information, go to the full announcement. Sorry, it's loading on my other screen. You'll see that this is a much more extensive text than what was in the e-list. So I just wanted to make sure that you guys always go to that link and read what is there so that you don't miss any information rather than just reading the basic e-list text, okay? Then the next thing I want to show you is the e-list archive again, because if you're like, did I miss something, right? I'm concerned I missed something. So what I want to show you again is we'll just keep using this MnCHOICES revision project page. It's what I used to get to it. Under launch information, you can see the DSD lead agency archive link. And if you click on it, it will take you to all of the e-lists that have been sent out from DHS. And what I sometimes do is I will use the find in my browser. Let me see if I can do this quick. Oh, find on the page, and I can put in MnCHOICES, and it'll highlight every single communication on MnCHOICES. So if I want to go back through and read them, I can, and I can see them easily enough and be able to know which ones I want. So I just wanted you to know that this e-list archive exists. If you're like, oh, did I miss an e-list? You can go in to this e-list, put in MnCHOICES, and then say, refresh yourself and say, yep, I've seen everything. Nope, I haven't. I missed this one. So I'm hoping that that will assist you and relieve any anxiety anybody might have about messages. So what are we going to talk about today? Today's agenda is really going to be about assignment, transfer, discharge, and the current functionality document version 3. So we're going to learn a little bit about how to request an assessment from another agency, how to transfer a person to another agency, and how to discharge a person. So we're going to look at both the forms that you use and the functionality in combination with each other, because we know that that workflow has been something that you've been asking about for a very long time. And then the current functionality document, what we're going to do is look at the additions that are in version 3, as well as review the 2 fixes that have occurred. And then there are a few other items that I'll talk about, and there, of course, will be time for questions. So that's the plan for today. Again, you may hear me use these terms. Lead agency means a county and managed care organization or a tribal nation. MNA means the MnCHOICES assessment application. MNSP means the support plan application. And if you hear me use MICP, that's the MnCHOICES interagency contact point, and we'll talk more about who that is again as we go through this presentation. So assessments and case transfers. What is on this slide is basically your instructions for forms. So some of the questions that you've been asking us is for counties and tribal nations, what communication tool are we using for assessments? So you'll continue to use the MnCHOICES communication form, DHS 6791E. For transfers, you'll use the Aging and Disability Services MnCHOICES Lead Agency Transfer and Communication Form 6037. For managed care, we're also moving you to the DHS 6791E for both pre-launch activity and post-launch activity to communicate to request assessments from another lead agency. And then lastly, continue to use managed care organizations. You'll continue to use that Aging and Disability Services MnCHOICES Lead Agency Transfer and Communication Form 6037. Sorry, I just want to make sure that we know what they're called, not just their numbers, because we all will refer to numbers and not have the complete information. So as you can see, in most cases, your work continues using the forms that you have used in the past. We are asking managed care to use the 6791E, both in pre and post launch, as part of their communication to request an assessment. So I want to take a moment and do some level setting for us, okay? Before we start talking about transfer and assignments and discharging, I want to just make sure we all kind of start on the same place, okay? So some of these are some questions that I've been hearing you ask, and I want to make sure that we get a chance to answer them. So one of the first questions is, may a person be assigned to more than one location? The answer is yes. A person can be assigned to each location that will work with the person. So if, for example, I may be working with a managed care organization and their delegate. I could be working with a county and maybe the county assessor and a contracted case management service. And we may have counties that are the COR and the CFR are working together. And actually the one I didn't put on here, but I should have put on here, is there may be an instance where managed care is providing a health risk assessment and the county is doing work. And so any combination that you can think of is allowed in this application. A person can be assigned to each location that works with them, just like the answer says. So the question has been about what people can assign a person. So what roles can assign a person to a location and staff, including themselves? And so here's the list of folks who can assign. It's pretty much anybody who you would have work with a person can assign a location and a staff member. And we've done that to make it easy for your agency, for however you do your work, to make those handoffs go smoothly, as well as to make sure the person has all of the staff that is required to support the work. So I wanted to give you some examples of what we were talking about. Not everyone is a verbal learner. Some people are visual learners, and I wanted to make sure we gave you visual examples. And so on the screen in front of you, you will see the first example is the CFR and the COR. So County of Financial Responsibility and County of basically location residency. What you can see in this example for the location assignment is there are two different counties assigned to the person. One is Aiken and one is Anoka. The second example is a location assignment where the MCO and the delegate have been assigned. So in this case, Blue Plus has done some front end work with this person, and then they have assigned to Aiken Blue Plus. You will note on here that I have not put the county on here separately because the only reason why the county would be on here separately is if they are doing work with this person that is not managed care related. Otherwise, the county will always be the combination Aiken Blue Plus or the county and the MCO. And so I just gave this example just to be clear about what hats people are wearing. And so that's why this example looks the way it does. And not picking on anybody on these examples. I often pick agencies at the beginning of the alphabet. So the next question is, ugh, that sentence isn't very good, sorry. So in this instance, what we're saying is, can you provide a duplicate location? So could Blue Plus be assigned and health partners? And you'll see that it won't allow you. So it'll say a person cannot have more than one active or approved pending location of the same type. So it can't have, in this instance, two managed cares active in this example. Oh, actually, in this example, what it's saying is, that's not it at all. What it's saying is that I accidentally tried to assign health partners twice. The reason why I think this question came up is I've been seeing it happen where I've went to assign a location and for a moment it doesn't show up in the location assignment. And so either I have two screens open one on top of each other and it tries to assign the second time and gives me the error, or I don't see that it's there and it assigns me the error. So in this instance, this error occurs because you've unintentionally tried to create it twice. It allows for Blue Plus and Health Partners to both be here, just like the two counties could both be here. But it might tell you, oh, you've already added it. Why are you trying to add it again? So sorry about that. I had to get myself clear on that one. So when is a staff member assigned to a person? It's basically anytime you're ready to have that person, have the staff member do work for the person. So we're going to demonstrate assignment. So we're going to look at this and what we'll do is we will add a location and a staff member. And so, sorry, I was looking at, whoops, who that was. Oh, hang on a second. I actually want to log in as, if I can, on your MTZ. Sorry, my PowerPoint is really fussy today. It's picking up my clicks on the screen from the other work. I just want to make sure I bring up the person that I'm going to demonstrate. So I'm logging in, sorry. You can't see that. Okay, so I'm going to go to assignment demo and we are going to add MCO and a delegate. So we're going to go to the assignment. We're going to go to location. We're going to add a managed care organization. And again, I'm just going to pick from the top of the alphabet. By no means is this any more than convenience. So I've added the managed care organization in this case. It's showing that it's active. I can go back to the assignment. I can choose the delegate. And again, I'm just going to pick from the top of the list for convenience sake. And so you can see both the MCO and the delegate have been added to this person's staff assignment. And then I can then add staff or the delegate and the managed care organization, and I'd have to know the username that I need, that I'm looking for, and assign them. So I could assign someone from Blue Plus for a role. I could assign someone from the delegate for a role, and move forward with it. You may from time to time get an assignment error or get an error, and so I wanted to talk a little bit why these errors occur. So in this instance, I'm getting an error. Cannot create a person staff member assignment when the staff member's location is not assigned to this person. So what is happening is, let's say you're trying to assign a certified assessor from Aiken Blue Plus, but you haven't assigned the location yet. You'll get this error. And so then you'll have to go back, make sure both are assigned. So just take a moment and read of course, the error message so that you know what's going on. So let's talk a little bit about assessments first when we think about doing your work. So when you need to request an assessment, the purpose will be the agency needs to notify another lead agency entry point that an assessment is needed. And so you can use the transfer process that's outlined in CBSM. And also you could use the form to the 6791E. The MCO care coordinator could use it to communicate with the lead agency as well. And so it really is a two-step process. One is using the communication form, and the other is taking steps in the revised MnCHOICES application. And so we're going to show you those so that you know how to kind of combine the communication form that you're going to submit in with the using the application. So when the COR completes a reassessment in the MnCHOICES, so part of, sorry, I'm going to back up a minute. So that's what we're going to show you. We're going to show you this. But we've also gotten some questions because people are confused about the workflow of this as we're in the launch process. And so don't want to cause more confusion for you as we talk through this workflow. My point of this next slide is to hopefully clarify it for you. So basically the question that surrounds this is the question that's on here is, if I do my work as a COR in the MnCHOICES assessment application, but what do I do after launch? Which system do I use? And so what I'm telling you here in this slide is you'll follow the workflow for where the assessment began. If the MCO is doing the assessment in legacy, then they'll do the legacy care plan. If you've done your work, as in this question is asking, if I've done my work in the MnCHOICES assessment, where will I complete my work? I'll complete it in the CSP and CSSP in the support plan. If I've started my work as a COR in the revised MnCHOICES application, then I'll complete my work by doing the assessment summary. And if I need to, then I will also myself as a user complete the support plan, or a case manager will complete the support plan. And then the same thing for health risk assessments, right? If a managed care organization is completing a health risk assessment in the revised MnCHOICES application, then they'll finish the support plan there. So we just wanted you to make sure that you understood that during this transition period, you'll follow the workflow that is based on where the assessment begins. And what we're going to talk to you about today is, if the process begins in the MnCHOICES assessment application, how do you take that work forward as a COR and CFR relationship, or if you're needing to request an assessment from a county as a managed care. So again, here's some examples. And in this piece, we're saying it doesn't apply to MCOs because we're just going to talk about these 3 scenarios. You have a COR where the location, when you have the COR, you'll assign the location to the person. Then you'll assign the CFR location to the person as well. Then the COR can notify the CFR using the MICP list. And you'll provide that MICP list the communication form. And you will probably tell them a bit about that the person's in the application. Here's their person ID. And then you'll follow your current process to request the assessment. So this example specifically is for county, tribal nation work for COR and CFR. Everyone kind of knows about the MnCHOICES interagency contact point list. If you should look at and review this list, and there is a way to update it if it needs to be, as well as if your agency for some reason isn't currently on the list, go look at it, make sure your agency is indeed on it. If they're not on it, please again put in a request to have MICP added to it, your contact added to it. It will improve the assessment handoff process immensely. So this is where you can update the contact point information. So we anticipate that all managed care organizations will be in this list, as well as all the county and tribal nations will be in this list. This is the update form. So it allows you to put in information, and then it is manually updated here at DHS. If you've put in a request but you don't see the changes, you're welcome to put something into the help desk so we can check in on it for you as well. So when you're in that CFR-COR relationship or working through other items where you maybe need to reassign staff, we just wanted to talk to you a little bit about how reassign works so that you understand it, so it doesn't cause you confusion when you use it, in case you expect its functionality to be different. So we're kind of starting at the basics of reassignment. So what this slide is telling you is that you will go to the person record, and you can see that we're here, and that we went to the assignment icon and we chose the staff assignment tab. Okay, so we did this, just so you know. So we went to the assignment icon, we did the staff assignment tab. And then in this example, it lists all of the staff that are currently assigned to that person. If you need to reassign staff members, when you click on the ellipsis to the right of that specific staff member, the reassign will be available to you to choose from. So you'll choose reassign. So what happens with reassign that you need to understand is that the staff reassignment window will provide you limited, will limit what you can do. So you'll see it will default to certified assessor. So you're reassigning to the specific assignment type, and it shows the staff member who it currently is, and then you will pick from a list of staff members who have that assignment type already. And so you'll pick from them. And then let me see, and then this is a comment field. So what you need to know about reassignment, though, is that you can only reassign inside a location. So for example, Aiken Blue Plus staff can assign to another Aiken Blue Plus staff person who's a certified assessor. White Earth Nation staff can assign to another White Earth Nation staff who is a certified assessor, but you can't reassign across other locations. So you can't reassign from Aiken Blue Plus to Blue Plus, or yeah, that's probably the easiest way to explain it. So you have to really think about what you're doing. For reassignment, it really needs to be inside the location. So if you're not assigning to the same staff inside the same location, then instead you would unassign staff and and then assign staff, the new staff. So that's what we'll talk about here. So I need to, instead of assigning Aiken Blue Plus to Aiken Blue Plus, I need to assign to a Blue Plus staff member instead. And so what I'm doing in this instance is, again, I'm going to the Staff Assignments tab, and I'm opening up the staff member record who's currently working for that person. And when I do that, in the status, you'll see Unassign. So in this instance, you'll choose Unassign, and then you will be able to then go back to the Staff Assignment tab and assign a person for Blue Plus. So just so you know. So I don't want to get any farther, but what you've learned in this piece is really that how to request an assessment. The key forms remains the same in most instances. And you'll use the form in combination with assigning the location and staff so that you can continue your work when you're requesting an assessment. And then what we did just a little bit was to kind of show you how assignment works, how unassign and reassign work, and how they will affect, how location assignment will affect being able to assign the correct staff, as well as how to use unassign when locations aren't the same and reassign within a location if you need to move a person. So I don't want to get any further than that because that's a lot. And I want to give Beth a chance to call on people who have their hand raised.
Okay, good morning. Leah, Fernandez? You are unmuted.
Right. Okay, I just want to, one form that wasn't discussed was the 7185, which is the case manager recipient information form for new assessments. That's not going to change. Is that correct?
Can you
Not
give
at
me
this time.
Okay, thank you.
Yep. Okay. Our next question is from Lane Magnuson. Hi, Lane.
This is Lane. So I just have a question about doing a courtesy screen for another county. On the 6791E, there's really not an option that says courtesy screen, so it's a little confusing, but can you go through the process of what we would do with that? Because a lot of them go to another county and they're not actually MMIS complete because the CFR needs to approve the financial determination of eligibility.
So I think you're asking two different questions, right? So the first question is, how would you note on the 6791E that you're doing a courtesy screen that's correct? You're doing it on behalf of another county that's requesting it.
Mm-hmm.
And I think that you could just make a note on the 6791E that that's what you're requesting. I think that's just fine to include that, and then we can, that's a good suggestion for the future updates to that form to include it, so I'll note that. And then can you ask me your second question again, please?
Yeah, just could you guys go through the process of how we would do a courtesy screen, just assigning it to the different county and the MMIS not being complete in our county because it's not really determined yet, those kind of things.
So for you, when
Well,
you're speaking, hang on a second. For you, when you're speaking about it, you're thinking about the status change. So I showed in both instances, you could have both counties assigned to assign to the person. So that your question is really about the status of the assessment. Am I correct?
Yeah, I'm just having a hard time wrapping my head around how I'm going to do this.
Yep.
So,
No, I hear you. So because you're thinking, so you've got two locations assigned, you've got the staff assigned. And then what you're wondering is kind of what that movement looks like between the two of them in a
Mhm.
little more detail.
Yep.
Sorry, I'm sitting here thinking about it too. Um, and I want policy to have a chance to, I'm sure they're talking to each other. And so I don't want to get in the way of that. I was going to see if I could bring some
Are
more
you
up.
asking more about statuses, or is it really we're talking about assignments and walking through the whole process with the status?
I mean, would you
Because
unassign
you're waiting for
yourself
approvals?
at some, so I assign
So,
it to myself, I can assign it to both counties, but then
right.
I mean, when it's ready to go, do I put MMIS approved and I unassign myself? How does that happen?
Yep. So your question is really about the handoffs. When do they occur?
Mm-hmm.
And so when I think about it, right, I think about that both counties would be assigned to it. Both the one county who initiates it assigns staff. You send the communication to the other county. The other county may assign staff. So now it has locations and staff assigned for both. Then the county who would complete the assessment would complete the assessment. And then your question is, because of financial responsibility, that county will need to review the assessment. So pending MMIS, and then after that, then um, who marks it approved, and when can the staff be unassigned is what I hear you asking about.
Yes,
That correct?
sounds good.
Yeah. Yep. So when I think about it, you want the handoffs to be successful, right? You want the handoffs to be successful. You don't want to have someone go off of caseload when something isn't done. The piece to remember is, because the system has messaging inside it, once you've done the handoff and you know who each other are, and you're in here in the staff assignments and you can go in and see who the other person is, then those folks could communicate back and forth on messaging, and put the assessment in pending MMIS. Then they could message the CFR, or the two could message each other, say, yep, it's ready for the next piece. And then you could determine who's going to mark it. I don't know policy if you would say anything else about that. And then at that point, then they could unassign themselves. You could unassign yourselves. You follow your protocol that you normally use, whatever that would be for how long you keep a person on a certified assessor's caseload. But you wouldn't physically move those folks, you wouldn't physically unassign staff until you knew the handoff was all the way complete and that it was successful, so that you're not having kind of anything get dropped, or if there isn't clarity on who's doing what. And is there any correction to what I'm saying that you guys would like to add? And I know that you're talking amongst each other, so I want to make sure I give them time.
Yeah, Teresa, I'm not sure that we'd add anything right now, but I think that we'll bring it back and continue to provide additional guidance on this topic
Okay.
and what to do when things are different and how to get through those statuses, because we know that that's something that you guys asked a lot about at office hours, and we want to continue to work through to make sure you have the right information out there. So.
And I can put it on a topic specifically, status as a topic for a future webinar, so we can look at it in a little more detail.
I think that'd be helpful.
Thank you.
Thanks, Lane. Okay, Bree. Hi, Bree, you're unmuted.
Yep, we can hear you.
Oh, great. I just had a question. I know in the original transition timeline, it had said that to complete those like county vocation assessments, like we would hit a point with that transition timeline where it was at the county's discretion whether they would complete those COL reassessments in the original assessment or if they would complete it in 2.0. Do you know if that's going to be the same case moving forward? That it's going to kind of be like up to the county's discretion? Because I think that's kind of where we were getting concerned is if we get those, the 6791E, I think it is, our interagency contact points, they get those and then they get it assigned to us and they get everything opened. And so I think they're kind of just wanting to know, how do we know if it's up to the county's discretion? How do we know if, let's say, Beltrami County is completing it all in the original assessment, but then we get it from ANOCA and ANOCA wants them completed all in 2.0? Like, is there clarification on that, or is there like a way like to have that be as successful as possible? Or maybe I missed it. I just wanted clarification.
So when I think about it, you're, so what you're asking is how are they going to decide and what happens if they decide differently? The
Yeah.
6791E communication tool should say on it which system the document is in.
Okay. That's kind of what I wanted to make sure, because I know there's a few different spots for comments to be added. And so we were wondering is if it's going to be up to the, you know, the case manager or whoever is sending out that communication form, if it would be up to them to note for us getting the document, hey, I want this completed in, or, you know, our agency is completing everything in 2.0, please complete the COL reassessment in 2.0 or one, you know, kind of, as long as there's something that,
Yep.
like, when our interagency contact point gets that, they can be like, oh, okay, we're getting this from this county, they want it completed in this system, we're going to open everything up in this system for the assessors.
Mm-hmm. Yep. Yeah. So it kind of goes back to that earlier slide that I had about where you started is where you complete it. And then your question further says, knowing where it started will help you know where to complete it. And it should be part of the 6791E communication is what I hear you saying.
Okay, yeah, so just that, so there's that communication moving forward, that
Correct.
that's the expectation is, when we do kind of move into that segment, that's kind of what the expectation is going to be then.
Yep. Yeah,
Okay.
you should need to be able to tell each other where the work is being done, and or where the person has been open for each of the computer applications. I think your question
Yeah.
that I might not be able to answer is about like which of the two agencies decides that. And I'm guessing that that has a policy answer that I wouldn't be able to answer, but I'm assuming
Sure.
it's the one who has to inform the other. So,
Yeah, and I think, you know, I guess, like, when talking with who I work with here at Beltrami County, you know, we're definitely open to whatever, you know, is the easiest. We just want to make sure that we're not like just, you know, Beltrami County wants to start using 2.0 right away and not wait. But then, you know, other counties are wanting to wait. We just want to make sure that, like, there's some sort of communication so that we're all on the same page and there's no confusion and mix up. And so if that's going to be on that form moving forward, that's perfect. That's what we were kind of hoping for. So I just wanted to clarify that.
so Beth, the only question that I would ask, because I think I'm making an assumption here that I don't want to cause problems for, I'm assuming there are comment boxes on that form that they can use to communicate that information. And then that they would also use the MICP email to talk back and forth to make sure they're on the same page about which application makes sense to do it in based on what the one needs.
Correct. I think that we'll have more guidance on that in our transition document, or transition guidance document that I think that we'll need to make sure that we include that, because there are specific situations. So like if it's an initial assessment, you know, you should be doing those in 2.0. That was originally our guidance, and I need to revisit it. So I don't know if others want to let me know if I'm getting that right or not. But
yeah, I think
I
the
think we need to add some
reality is,
clarity.
yep, that's where I was going to
Go ahead.
go exactly. I think the issue is more about with the length of time that is out there for what for the transition period, what does that look like in a larger window?
Mhm.
Yeah. And that,
Yeah.
yeah, and you heard Beth say we'll provide some more clarification on that.
Okay. Yeah, that's great. That was on my mind, so I wanted to ask that. So thank you so much.
Mm-hmm. Beth, do
Thanks,
we
Bree.
have a number of hands still raised? I just want to make sure we stay good about time and whatnot, because we're almost an hour
There's
in.
one more person.
Okay,
One more
cool.
person.
Thank you.
Okay, so Shannon. Shannon, you're
I just
unmuted.
wanted to, can you hear me?
Mm-hmm.
Okay, great. I just wanted to add feedback to that discussion, and obviously with putting the brakes on things, the gradual transition, everything's going to look different. But Clay County, we're going to try to get on to 2.0 as much as we can, but I think we were finding a lot of comfort in that gradual transition. And when you do those county of locations, for counties that have a high volume, I think that I would really like to see the county who's doing the actual assessment have more of the say for that. When, because they're the ones actually doing the work, and they have a big picture of what works with their agency. So I'm just wanting to provide that feedback as we're kind of trying to map out what it's going to look when we launch whenever.
Thank you. We'll take that information back.
Thanks.
Yep. I'm going to go ahead and move on. Okay. So let's take a little bit of time and talk about transfer and discharging of a case and how the computer application sees those terms. So transferring a person is from one lead agency to another lead agency, or a contracted case management agency to a delegate county, or, kind of all those combinations where you're going to transfer a person because they've moved or something else. And then discharge is when you're closing a person's case. So you're actually closing that person's case out, and that's what it means by it. It kind of remains like the last one. It's a two-step process. And in this instance, you're using a different form. You're using the DHS 6037 form for both pre and post launch. And that communication form is used by both aging and disability services for lead agency transfers. And so you'll be using that, and then you'll follow the physical steps of working inside the application to post launch when you need to transfer or discharge a person. So we're just going to talk through that, just really brief. So again, you'll use the process that's outlined in that form, in the 6037 form. And there's also two scenario forms that go with that form. So we really ask that you read through and look at those scenarios. They will answer questions that you have about transfers and communication. And so the question also is, do we attach the form to the person's record, that 6037 form to the person's record? And we say that it may be loaded, and we have best practice here. This before the transfer, you could upload the form to the person's attachment, put it in their correspondence, and so that way it's there too. So beyond the giving the communication tool to the other agency, it also we're suggesting that you attach it to the person's record, that you do both. So what does transfer look like in this application, and where does it occur? Where will you find it? So when you're in the person record and you went to the assignment tab, see if I'm not timed out yet. So if you went to the assignment tab and you click on location here, you'll see transfer show up on the location. Okay. And then I think one of the things you'll just want to ask yourself is who tracks transfers in your agency, and make sure that they understand this transfer process. So what happens when you choose transfer as functionality is you get this transfer window that comes up. And again, you'll see that it will automatically default some information. So it automatically defaults that the assignment type is managed care. And so to transfer, it's going to say to you, you can only transfer to a managed care organization. Okay. It's all it's going to let you do with transfer. It's currently to a managed care organization. If you're going to transfer using that functionality, you can only transfer county to county, MCO to MCO, tribal nation to tribal nation. So the question you're going to ask me next is what happens when I need to transfer outside of a similar assignment type. So this is just showing you for the same assignment type, then you pick the location and you pick the effective date and you do save. The other piece to know about transfer, and then we'll get to the question I asked earlier, is once you pick that effective date, what will happen is that if you're transferring from, let's say, one county to another county, what will happen when that happens is on that effective date, that person will move off the caseload of the current staff and they'll move on the caseload of the next staff, if there are staff members assigned. And it'll remove it from one location, will go inactive, and the other one will show active. So it won't send a notification, but it will just occur. So communication, of course, is going to be key in this handoff. You're going to have to use the 6037 and connect with a person, with a staff member, and you're going to need to make sure that form, once it's been given to an agency, that you also attach it so that everyone knows what's going on. So what happens when you need to transfer to assignment types that aren't the same? So I just put all the ones I could think of in the example. And what that means instead is that you'll have to transfer a different way, use the functionality of the application differently. So what you'll do instead is you'll add a new location to the staff, to the person's record, and then you can then add because the person can have more than one location at a time. So in this example, let's say if I was transferring someone from Blue Plus to someone at Anoka County, I could, instead of transferring, I would add another location to the person's record. So and I would pick the date that was effective. And then that location would also show up here. So now this person has another location on their record, has Anoka on their record. And then what you would then do, right, is use one of these contact lists to let that agency know that you have assigned their location to the person's record and who the person's ID is. So in this instance, I could go in my form, I could say, here's the person's ID. I have added them as a location to your location. A transfer needs to occur. You'll use your forms, the 6037, and then there's this form as well. And then you'll use one of these lists to figure out who to reach out to make that transfer occur. And then again, how long will you leave the location and the staff from both agencies on will be something that you'll have to work out through communication with each other. Okay, so that's that piece. I'm going to take a breath a minute and talk about what does discharge look like and where do you find it? So the one piece you need to know about discharge for location, for discharge, you need to know that you have to actually unassign the staff before you can discharge a person's record from a location. And so what you will do is you will go into the staff assignment section and you'll move everyone to unassign. So you'll unassign all of the staff because you won't be able to discharge until you do. It'll send you a message that says you still have staff on it. And then when you unassign it, will ask you the reason why you're unassigning the person. And so this one's here just to show that you can add a comment as well, because you can't see the comments here. The drop-down menu covers it. Then you will go, once all the staff are unassigned, you go to location and you can choose discharge. And when you choose discharge, you're going to get a discharge window. And this discharge window is going to ask you to basically give you the reason on why the person is being discharged. And then, like the other one, there's a comment box available too, so you can add any additional questions to document why the person has been discharged. So part of what I wanted to do is let you know what there is for support for you. The Help Center has a SMART guide that's called Assignment Transfers and Discharges. I loaded it to your MTZ site yesterday, so it is available. The SMART guides are a walkthrough of each of these terms and how to do them. You also have the micro learning that's available to you, and then you have the forms that we talked about today available as well. So before we get any further, I want to make sure we don't have questions that we need to answer.
We have a question from Angela Despo. Hi, Angela. Angela, you're unmuted.
Let's go ahead and mute Angela and then come back to her if there isn't another question.
The next question is from Giovanna.
Giovanna, you're unmuted.
Oh, Giovanna muted herself. Let me try again.
Hello?
Yep, we can hear you.
Oh, hi. I thought, well, anyway, my question is about forms. Does this affect forms in any way? A lot of scenarios that come to my mind is assessing a person that has just recently got on MA and they are straight MA. And then while we wait the eligibility for the waiver, they get on health plan. So in effect, our assessment form would still be open as it was before the enrollment, but now they're enrolled, and I don't know if the form itself would be affected. All that location and assignment change, would that affect the form that we have completed at the time of the assessment?
So in your example, you've completed the assessment and then you have found out that while you were waiting for MA and you found out the person moved to health plan. Is that what you said?
Yes, that's correct.
Okay, sorry. I just want to make sure I heard you correct. I'm giving policy a chance to converse with each other. Because in this instance, this is really more of a policy question than a functionality question. So I just want to make sure they get a chance to talk to each other before we respond.
So you're asking, I'm going to repeat your question to see if I'm getting it. If you are, you completed the assessment, you are, or your assessment's still open and the person then accesses MA and you're wondering if,
So
you're wondering if you have to do anything with your assessment. I'm missing it, sorry.
No,
no,
the health, go ahead.
So sometimes we assess people and they right around that time they get on medical assistance, but it's not MALTC, which is the right kind we need for waiver access. And we're waiting on all that to be sorted out from financial standpoint. In the meantime, the person gets enrolled in health plan. Many of our elderly do enroll in health plan. And now we have this assessment that we completed that is for fee for service, presumably location and assignment in MnCHOICES would then be just the county location. And then all of a sudden there is this new location, whether it's Olmsted Blues, Olmsted UCare, whatever it is. Will that affect the form, the actual assessment form that we have completed prior to enrollment to health plan?
So to answer the
Mhm.
to answer the functionality question, the form isn't affected. It's there. You can see it,
Okay.
you can view it. I think the question is what happens to it?
Okay.
Because you've created the form, you're waiting for MA.
Mhm.
The form detail exists from kind of a purely functionality standpoint. That form exists. The question is what to do with the form, and that is a policy question.
Okay. The one other thing I want to add is we have, and you have pointed out also the differences between support plan for non-health plan, or I should say
Mhm.
non-MCO and MCO. And maybe it's a matter of at one point do we do support plan according to the guidelines, way back when we should do them within 40 days of the assessment itself. So now when they switch over to a different to an MCO, support plan potentially may not contain things that are required for MCOs. So anyway, just kind of
Yeah, so I think
thinking.
I think in that case, the handoffs would stay similar to what you're
Mhm.
currently doing between the two agencies. And the
Okay.
kind of what needs to be done remains the same. It's just that
Mhm.
you have this document that you've created in the application that you're wondering about basically what happens with it.
Okay, as long as there's no, all of a sudden the form closes and then as long as that doesn't happen, I guess
Unless
we should
someone
be good.
physically does,
No,
unless that would
Mhm.
only be if someone physically did it, right? It's just
right.
purely functionality. It isn't interacting with anything.
Okay. Okay.
Mm.
Thank you.
Yeah, the
Yep.
form will still be there for your use. Yeah.
Thanks.
Yep.
Okay. Okay, so Angela couldn't get her sound to work, so I'm going to read her question because she said, my question is, when you put in an effective date for the transfer, will the system automatically assume that that's the official date of transfer? Sometimes we get transfers, the financial worker determines the CFR switches later than the case manager thinks it should. We are unable to work with them until the CFR changes officially in MMIS.
So in this instance, you're talking about two different agencies, or yeah. So I'm thinking you can control that. So that's what I was looking at. Sorry, I have to go back and look at it, the slide itself. I don't want to make you guys have your head spin while you're looking at this. So in this instance, you're saying county to county transfer, and you're right, the effective date would then transfer. And so your question is, oops, you don't want to transfer it too early if you're waiting for information. So you could pick a effective, I mean, the reality is, you could pick a effective date that's enough in the future, and then you would just share it for a while. And so you could kind of use that as you needed to, and if you wanted to unassign the location earlier, you could. But I think just to make sure that you didn't lose contact with it and you didn't mean to, is you would probably put the date a little bit further out than what you would need to, is how I think about it from a functionality standpoint.
Okay, we'll go on to Ashley Horak. Hi, Ashley.
Okay, can you hear me?
Ashley, you're on.
We can.
Yep.
Okay, good. Going on and off with mute. So going back to your MCO example about the location assignments, you had 2 location assignments essentially for the MCO. The first was the actual MCO, and then I noticed the delegate agency, which is the MCO/delegate name. Are we required to always have 2 locations when it's a delegate assignment?
That's just really based on workflow, right? Like if you get the list from your MCO and then you do it as a delegate, just as a delegate, then you wouldn't need to. My point to it was showing you that you could. You can have 2.
Thank you. Great.
Okay, Terry Booker. Hi, Terry, you're
Hello.
unmuted.
Hi, thank you. I work for a delegate agency, and my question is regarding the timing of updating the system. Currently, we are expected to send the 6037 before the 15th of the month. If the transfer to another MCO delegate agency occurs on 4/1, that form would need to be done before 4/15. Is the expectation going forward in MnCHOICES that that's done before the 1st of the month?
Because I picked that date, is that what you're asking?
Well, if we have a 4/1 transfer, when is the expectation that we update the new delegate agency and send that up? When do we update the new delegate agency in the MnCHOICES environment? Is that before the 1st of the month when, if it's a 4/1 effective date, or after 4/1, or doesn't it matter?
I don't think MnCHOICES is changing anything about current policy of how you do that. Teresa, would you add any more there?
Yeah, so I'm sorry, I was sitting here thinking about it a little bit because I mean, what you have to do with the system is to make sure you follow the policy in how you use the system. So if you're using the specific transfer functionality between like agencies, then you would have to make the effective date work for that transfer process that's in place and the timing that is required by policy. And that's where you get to the putting the effective date is really about when it literally goes off of one person's caseload to another person's caseload. And so, or off of the system from one location to another location. And so you want to make sure you give it enough time. That effective date is literally the computer system's on and off switch. It's not the effective date from a policy standpoint. So don't confuse the two, functionality with policy, I guess is what I would say.
So for a 4/1 effective date, if I enter a 4/1 effective date on the 17th of April, it's still going to be a 4/1 effective date.
It
But
will
it's
transfer
okay.
it. It will transfer it immediately to the next location. You will have to search for the person to find them.
Correct. But it's okay if I don't update that until the 17th. And the reason I'm asking is because we get new enrollment back to 4/1 on the 17th, 18th, 20th of the month.
I just remember transfer inside the system, that date is literally about functionality. So don't
Okay.
get tied up onto what that date says about anything. And what you want to make sure you don't do is make it impossible for the two of you to work together and do handoffs, right?
Okay.
So you don't want the functionality to get in the way of that, which is why Angela was asking the question she was asking. Sometimes there's you're doing the handoffs and it takes a bit of time. So that is literally functionality of the system. That's all it is. And so you'll just want to be planful and thoughtful about that. And if you feel like you need to put why you've picked that date, if there's a comment field, you could put it in there. But it really is just about telling the system when to move it. It's no more than that.
Okay, thank you.
And Beth, I want to make
Teresa,
sure we
we have
get
one
to
last.
the, okay, one more. Yep.
Yeah, Okay. Leah?
I have a pretty easy question for you. I looked in our current MTZ that we have access to in regards to the transfer from another county to another county. I know MNR will not give you a notice, but is there a report or query that can be run? I don't see one in our current MTZ.
So reports currently aren't on in your training zone. They're kind of we're working towards them for future. Will there be one for transfers? We would have to go back and look in the report list to see. I can't answer it off the top of my head, but it's
Okay.
something I could come back to and answer at a future webinar.
That'd be great. Thank you. Because that would be very helpful for us to be able to report to say, hey, this is what we have right now.
Okay, I put it
Thank
on
you
my
so
list.
much.
Yep. So Beth, I'm going to go ahead and keep going. I just need to make sure we get through them all and get through the slides, as well as make sure people have time to answer questions on the other slides.
Sounds great.
Okay, so currently what I am going to do is we're going to walk through the current functionality the new items, and we're going to talk about the fixed items. And the first thing I want to do is one of the things that we heard you talk about is concerns about making corrections to forms and giving it to the person and what the person will wonder about. And so what has been created is the DHS 6791K, and it is a cover sheet. And so what you can do is you can use it when the current functionality workaround requires you to do a correction on a document that you're giving to someone. It explains kind of the why. It gives them information that yes, this is supposed to happen. DHS is having you do it. And so I'll show you a screenshot of it. And so for people who are listening to this verbally only, what it says is about the MnCHOICES document you're receiving. And it says you may notice changes or additions to this document. They may show up as hand corrections, type corrections, or printed from an online screen. And you just need to know that DHS has asked agencies to make these changes when they're needed. And this is to make sure that your information is correct. So we're providing this to you as agencies, so you have it. You can provide it to a person for their assessment or support plan if there are corrections on it that are required as part of workarounds, so that you can provide this to them and that they know that, it just wasn't you doing it, that it's a requirement of instructions that we've been giving you. So every time the current functionality document is updated, we will change the version number on it. So we are now on version 3. Version 3 was just uploaded to your MTZ site last week. I updated it as soon as it became available for PDF. What you will see different about it than you have seen with others in the past is anything that has been new added to it will show new after its name. So it'll be easy to see the new ones. It won't be hard for you to follow it. The other change that has been made is that our folks here, our leadership folks here, thought it was important for you to know the critical functionality, the ones that are the most critical for you to understand, or your agency users to understand. So there's a section called critical functionality concerns, and literally all it does is provide you the links to the ones they want to make sure are understood. And then when they click on them, it takes them down into the document where they can read the description and follow the workaround. But we know for many folks, there was a question about just about how will we know which ones are most important. And so they added this functionality to the document to try to assist you in that effort. So we have 2 items you heard Mary mention that are fixed. And so I will ask Beth Siewert to talk a little bit about these 2 case mix fixes. And their headings that are in the current functionality document version 2 are available here. So you can go back to the version 2 document and review it. Go ahead, Beth, when you are ready.
Sure. this is about where the first one where we had talked about mobility was for people over 65 was moving people from an L to an A as a critical dependency, and this has been resolved. So mobility no longer will be seen on that critical dependencies list. It won't be counted as that, and so the case mix will calculate correctly as an L in circumstances where it should. The next one is about confined to bed, and this was about transferring that it wasn't seen when someone is confined to bed, they should also have a mobility dependency, and we weren't seeing a mobility dependency, and that has since been fixed as well. And so this will now calculate correctly as a mobility dependency. So
Great,
that's all
thank
we'd
you,
say
Beth.
about that. Yeah.
Okay, I'm going to move to the next item. So where we are moving to, we did not do it for version 3, but where we are moving for future state is when the current functionality document is updated, what we will do is if the release updated a fix, and we will then update the version and cross out that the release has fixed it. It'll get a new version date as well. And then what will happen is, so for folks who have done this before, you'll have seen this in the support plan known issues, for example. We'll cross it out for right after that release. And then when the next release comes, we'll remove it entirely from the document and then cross out the next fixes. And so this way that will be your way of saying what got fixed in the release off the current functionality document. You'll be able to go in and see the ones that have been crossed out, and you'll know. It'll be your kind of fast reference to, gosh, I can't remember if that one got fixed or not. You know, we're having an issue about this. Let's go see if it was fixed. Oh yeah, it was fixed. Or we're like anticipating an issue. Let's go see if that's been fixed. And so it'll be a very simple visual moving forward so that you know items have been fixed. So what we're going to do next is we're going to walk around. We're going to present to you, work around and walk around. Anyways, we're going to present to you each of the new current functionality additions and have policy talk you through them. So this first one, Merritt, are you off mute and ready to assist me?
Meredith, it looks like you're off mute, but we can't hear you.
Yeah, sometimes people are double muted, and so this handoff may just take a bit of practice for us. So we'll just give Merritt a moment.
Okay, now can you hear me?
We can hear you now. Thank you.
I'm so sorry. Thank you, Teresa. Yes, what I wanted to talk to you about today was the OBRA 1 and the HELPS brain injury screening document. The forms are able to be taken offline. However, at this time, they're not editable. So what you'll need to do is take the forms offline so you can reference those while you're in the field, and then you can complete those when you're back in the office and when you have access to the internet. And then the other thing on the OBRA 1 form, you'll put the doctor, there's a relationship type for professional medical in the person's profile, and that's where you'll add the person's doctor name. And when you create the OBRA level 1, that doctor name should be populating in the OBRA level 1. However, it is not at this time. So what you'll need to do is print the report, and then you'll add the doctor's name to the OBRA level 1.
Thank you, Merritt.
Yes, thanks, Teresa.
Yep. So this next one, Amy Alexander will present.
Good morning. Can you hear me okay?
We can, thank you.
Okay, good. So hi, this is Amy Alexander, and yes, I'm going to talk about this issue, which is regarding the MALTC status. And so we've talked a little bit in previous webinars about kind of a nice functionality within the revision is that there will be a connection to MMIS that nightly will upload the person's MALTC status. So when you're on the left-hand navigation bar, the health information and health insurance, you'll be able to see the person's MALTC status. This issue is about a limited number of records that we've discovered in some of the testing, where that MALTC status really should be showing eligible, but for some reason in the data migration, it's coming up as unknown. And so when you go and check that person's MA status, you'll see that unknown, and we'll have to do some further investigation, kind of like you would have, without having this connection, to make sure that the person actually does have MA. And so if that is the case, that it says unknown, and you find out that they do in fact have MALTC, you'll go into the program-specific requirements, and Teresa has a screenshot right there, and you'll go into the status where it says unknown right there. You'll change that to eligible. So that's the workaround. It's a very limited amount of people, pretty rare occurrence, but we just wanted you to be aware that once in a while you might see that it says unknown, and then you'll find out they do actually have MA, and we'll just need to go into that section and change it to eligible.
So the next one, I have Kathy presenting this slide.
Thanks, Teresa. Can you hear me okay?
We can, thank you.
Great. So this next one is about services that are not authorized through a waiver or MCO. And this is when you're setting up a new assessment, there is a question that asks if the person is receiving other services. And if you answer yes, additional services should display in the support plan, but they are not right now. So for example, one of the services that isn't showing up is developmental disabilities case management. So what we need users to do at this time is to go in and choose the service type, people and community organizations that support me. Then under the provider name in the organization name field, you can put a description of what the organization will provide. And if there is no organization, then you can enter the service description in the comments field. At the bottom of the add services and support section, that is where this is located, and then you would save that.
So I will do this one. So the description for this one is that some moving home Minnesota services aren't currently being added to the support plan forms when using the services that support me option. So there are 6 services that all have a different variation of cost for finding housing and employment that aren't displaying when you use the services that support me. And so in this service type, instead of choosing services that support me, you'll choose people and community organizations that support me. And then you'll put the provider name in here. And then you can also add any additional information that you want to cover about the service in the support description and the comment field, so that you have the documentation for those fields that aren't displaying. So you'll enter everything else in the person's support plan and service type services that support me. And then for these few, you'll then be able to pick people and community organizations that support me and add the documentation as it notes here. So this next one, Beth, I have is yours.
Yes, this is the support plan about about plan section. And for the support plan, it's about the CFSS budget and eligibility information that shouldn't be printing when the person is not eligible for CFSS. And so when the person is, say, in provider-controlled housing or not seeking CFSS, so you're writing NA in the assessment, the information will come over those. The assessment will still total hours for CFSS, but the assessment will say in the program summary that the person's not eligible for CFSS for those reasons. But the support plan is still capturing that information, and so with this, until this is fixed in the system, you will need to redact the information in the about plan section prior to sending this out to the person, so that it doesn't appear that they're eligible for CFSS when they are indeed not eligible for CFSS.
Thank you, Beth. So Victoria, I have this one as yours.
Good morning, everybody. Can everybody hear me?
Just fine, thank you.
Oh, good. Yeah, so there are 3 that we'll go over in regards to support plan and the signature portion. The first future enhancement that we have identified that hopefully will get fixed sooner than later is right now you can only view electronic signatures within the application. So if you would like to have a print version of electronic signature, you'll have to go to the browser and go to File, Print, and then you can have a print version of the electronic signature. Now, rest assured, you can still see the e-signature within the application. It just doesn't print. And the next one. The next one has to do with the provider signature block acknowledgement. The formatting of the information in regards to the provider's acknowledgement is not accurate. The information's accurate, it's just the formatting isn't easy reading to use. So our workaround at this point is that for the user to just read out the provider's acknowledgements. We're hoping to have that in the future. We're hoping to have that more laid out in bullet points. And the last one. The last one is in regards to handwritten signatures. We do not have an actual signature block or box to guide where someone should actually handwrite on their printed support plan. So this is just a screenshot picture with suggested areas to where the person should sign. In the future, we hope to have some kind of either a line or a box that kind of indicates where the signature should go. That's all I have.
Great, thank you. And so this screenshot then basically just shows you the items that we talked about today that were added to the document as a complete list so that you can see them. Beth, do we have a bunch of hands around these current functionalities? Should I stop a moment and take a few questions? Otherwise, I was going to do the other updates.
We just have one question.
Okay, let's go ahead and do that because there's just a few slides for updates. It won't take the whole time.
Okay. So Trista Holbus.
You had touched on case mix. I'm just curious about PCA home care rating. Will there still be an LT home care rating after MnCHOICES launches?
No, that's why you're using the PCA conversion worksheet. If the person has a home care rating of PQ or R, you'll use the CFSS to PCA conversion worksheet, and you'll convert that PQ or R to the correct rating. So if the person really should be LT, it'll convert them automatically to LT. And so you use that form to do it because we programmed MnCHOICES for CFSS launching. And so we just need to do a conversion.
Do we know when we'll be able to see what that worksheet looks like?
I'm trying to think of when you'll be able to see it. We can figure out something. We have looked at that in past webinars. I can't remember the specific date though that we looked at it for you to go back and reference.
Or is it like an e-doc where we can just look it up ourselves?
We can take that back and see. I'm not sure that there's functionality in it. So it's like you're really entering in 3 fields. And in those 3 fields, it does math. It does the algorithm in the background. And I'm not sure we can recreate that necessarily quickly in an e-doc for you to see how that would work. But we could maybe plan to demonstrate it again for you at a future webinar.
Okay, just kind of trying to figure out how we could practice it while we prepare for using it.
It's pretty simplistic. It gives you lots of instructions as you're going through, and it's just 3 fields that you're filling in. It tells you if the PQ or R is converted to an LT or if it remains a PQ or an R.
Okay.
Okay, thanks, Trista. One more question is from Michelle Fisher.
Good morning. One question. On the health insurance information for the long-term care MA showing up as unknown, did you say that certified assessor would be able to change that, or would that need to go back to MnCHOICES to have you update it?
It allows
should
for
be able to change it.
Yeah, it allows for you to edit it.
Okay, thank you.
Yep.
Okay, Teresa, we can go on.
Okay, thank you. So let's just go through a couple of other smaller items. So I have had a few other questions that people have asked about, and so we just thought we'd take a moment to answer them. So there's still some question about what gets attached to a person record. Is MnCHOICES intended to store all documents? It isn't. So basically the answer is your lead agency has protocol about how your agency stores documents. You'll continue to follow that. And then the other question was how long will MnCHOICES store documents? And then that will be set by the DHS data retention policy. And rather than trying to provide you all that detail, we provided you the links on what that policy is. So DHS will follow data retention policy standards for any data that's stored in MnCHOICES. So I wanted to give you a couple of updates. There was an e-list on March 7th about functional needs update for AC and EW. And we just wanted you to be aware that we updated the training. So the MnCHOICES assessment content, the MnCHOICES content course on MnCHOICES assessment, initiate assessment and activity information, it's a lot of S's in a row, has been updated. So the easiest way to see that is to go to MnCH 301 and then find that specifically if you're already certified, and then your new staff will see it as just a normal part of their step 3 part 1 content when they take their training as part of certification. But if you would like to go back and review it yourself, you should be able to see it in 301A. So another question that we got was which documents are we required to send to the person after their revised MnCHOICES assessment? And we wanted you to know that there are forms. There is a CBSM page for forms used for waivers, and the MnCHOICES County Link assessment page also provides a list of using MnCHOICES forms. I was just gonna try to go there quick, see if it's been updated yet.
She said has not.
It hasn't been updated yet. So right now we have, right now we have for the MnCHOICES assessment, MnCHOICES M&A application, we're going to add a line here for documents and reports for the revised MnCHOICES application. it's very close to being done. We've been in contact about how to organize this page so that you can easily tell it apart. So I know that's where it sits. So you will be able to use both of those reference points as a way to look at which documents are required to send to a person. The CBSM reference page and the County Link page will both be available for you to use, so you can answer that question. Then the other piece we wanted you to be aware of is there was an announcement on the MnCHOICES, and we just wanted you to know that yes, that form is available as a DHS EDOC form. It's now available and includes the instructions and for the administration of using MnCHOICES. And that was literally all that I have for updates. We can take some more questions. We have about 18 minutes left before this webinar is done. It doesn't have to be on any specific topic. If you have questions that you need to ask about the functionality of the revised MnCHOICES application and training kinds of questions or other questions to prepare your agency for launch, we have time to answer a few of them.
Okay, Teresa, we have a question from Mary Lee.
Hi, Mary Lee. Mary Lee, we have you off mute. I wonder if you're muted on your side.
We'll go on to our next question and try Mary again in a second. Dorothy Ball.
We came in a little bit late. Was there a date given where the anticipated launch will happen?
There was not a date given. There will be future communication. Mary talked about it being weekly or every couple of weeks to keep you updated on to answer the when question for you.
Okay, thank you.
Yep.
Okay, Heather Johnson.
Hold on.
Hi, Heather.
We can hear you. Yep,
Oh,
we can hear you.
okay. Hi, I am just checking on the MALTC status. Thank you for going over that. The question that I am wondering about is because different eligibility gets done depending on where it's in the workflow for the financial worker. So we are not aware of when that could happen unless we happen to be communicating directly with the financial worker. So with the overnight basically upload, is it possible for us to just look almost daily to see if that has been approved yet or not?
So something to think about, hang on a second, Beth, something to think about is if you're speaking for certified assessors, Maxis does have a read-only role available to certified assessors. And so you could use it.
I'm actually one of the supervisors. I'm sure that they're doing that. I just know that because this is one of the areas in addition to disability certification for under 65, that those are the two areas that seem to take time. And of course, we're unable to finalize anything until those are in place. So that was why I asked that question.
Yeah.
Teresa, this is Amy. I can speak a little bit more to that as well.
Thank you.
So nothing will change about really nothing about your process that you do now will change. The ability to see the status in the revision, in MnCHOICES revision, is just kind of like more of a courtesy. Like you're able to go in there and look at it to get a good view, but it won't change anything about your process. So as long as you create that form after that health insurance has been loaded, which it will do every night, you can change it to whatever it is, whatever the status is. So if you're working in the assessment and a couple weeks later you get word from the financial worker that it's good to go, you don't have to wait until that nightly load. You can go into the form and change it and your eligibility will run just fine. So it's not really changing anything about how you've done it in the past. It's just giving everybody kind of a quicker view to see that nightly load. Does that make sense?
That's really helpful. Thank you very much,
Okay.
Amy.
Yep, you're
Appreciate
welcome.
that.
Okay, Kim Perko. Sorry, help. There you go. You're unmuted now.
Any idea as to when the AWS testing zone will be available for us to use at all? I believe last I heard it was just around the corner, but any updates on that?
We do not have an update on availability to date.
Okay, thank you. Second question is, last October, we sent the onboarding lists to DHS, and the folks were onboarded last October, and then now we need to do a new onboarding. Has there been any consideration, or could there be any consideration for DHS to do a new onboarding rather than the MCOs to do the onboarding, simply because we have lots and lots of folks that do need to be onboarded? And now with a potential 60-day delay, which we much appreciate, thank you, we'll have additional ones that will need to be onboarded. And we're talking, like, you know, for us particularly alone, we've got probably 500 folks that need to be onboarded right now today, not including, you know, this additional time between now and when we actually launch. So just wondering if there's been any consideration, or could be a consideration, for DHS to actually do another onboarding.
So we have, so basically the answer is no, we can't load folks again through an onboarding process using spreadsheets. The chance of duplication and other issues is greater than the risk is too great. So what we have in place is what we talked about at the March 8th webinar. You can go to the DSD archive and review that. Agencies will be able to submit a bulk user form for 25 users at a time that need to be added to the system. That form will be available day of launch. We also, in communication, have put out the fields for those forms in order. So you could potentially create a big spreadsheet right now and collect all that data, so you could copy and paste it into that form and submit it the day of launch. That's the best that we have been able to do to accommodate that issue that you raised. Beth, are there any other questions?
Hi, this is Maria. Can you hear me?
We can.
Okay, wonderful. So this is regarding, I'm a certified assessor, and when we often go out on an initial assessment, expecting it to be PCA, CFSS, whatever, it sometimes will change into something different. It ends up being a CADI assessment or whatever. And if it was going to be a PCA assessment, we have to bring out a copy of the support plan so we can get that signature sheet signed at the assessment. Okay, and am I making sense here? So one of the first things you need to do when you open up a support plan is you have to choose the primary program for the person. And when we go out on an initial assessment, we don't necessarily know what program they're going to end up on, because it's initial assessment. We're kind of feeling things out. And we have to choose the program from the drop-down menu, and it is not editable. This needs to be an editable field, because when we go out, we just don't know. Is that possible? Or do I have this, you know, then we've got a support plan that has the wrong thing if we choose CFSS and then it turns into a CADI assessment. How do we work this?
Can you provide us it doesn't have to be which lead agency you work for, but are you speaking from an MCO, county?
Nope, county, Crow Wing County.
Thank you. Just I wanted to make sure that we had that for background.
Yeah. So I'm not sure, again, I'm not sure if it's going to be different in the product than it is in the MTZ, but right now, you know, in order to create a support plan, we do have to choose that program right away when we don't know what program they're going on.
Yep, and I hear you saying that you're bringing out the assessment and the support plan at the
Yeah.
same time.
Yeah, we are, because we need that because the signature sheet is integrated into the support plan. And for PCA only clients, the assessor has to do the support plan in addition to the assessment. And but sometimes we go out expecting it to be for PCA. So we pull up the support plan, we click CFSS, and we're going out there, and it turns into something different, a caddy. Let's just say, I'm just saying a caddy is what it most commonly might switch to. So how do we have to just discard that support plan after we get the signature and then get a new one? Do we always have to choose CFSS when we go out? Because that's what it could be. You know, I'm not sure why we have to choose the program that they're going on immediately rather than making that something that we can choose later after we know for sure what program they're going on.
So the reason why you heard me asking you just a couple of clarifying questions about that is I was just thinking about the functionality, and I'm letting policy have a chance to have a conversation in the background about the policy section of this. So when I was thinking about it, right, if you're going out and you're doing an assessment offline, the assessment isn't complete. And so I was thinking about what support, if you then also created a new support plan, what it would be in the status of in progress, but not complete, not assessment complete. And so I was thinking through that piece of it when I was, before I was thinking about the functionality of it.
Just in order to create the support plan, period.
Yep,
In order
nope,
to
I
make
know.
it, we have to choose the program.
Yep.
Can that be moved to a
And
later point?
There are specific reasons why, because of services and fields that show for CFSS versus not CFSS, or other programs of why we had to do it the way that we did. But what we'd like to do is take this specific question for initial assessments offline and have some more discussion about it and maybe bring it back up. Not maybe bring it back up, we will bring it back up at a future webinar so that you can, or so that we can get an answer to it, so that you're bringing up something very interesting for us that we would like to consider how to give direction on it in the future.
Okay, or else make the signature sheet able to be taken off, or make that something separate, not necessarily integrated into the support plan, because then that, you know, I don't know, or a way to figure that out. I don't know, but I just wanted to bring that up.
Okay.
Thank you.
Okay. Our next question is Alyssa Bay.
Hi, I was just wondering if you can repeat what you said at the beginning about the updates with CaseMix, the functionality. I was trying to double check it, but the functionality, the new version isn't up in Training Zone yet.
Regarding mobility, the two case mixes that have been fixed. So mobility for was showing as a critical ADL, causing causing the person's case mix to move from an L to an A, and so we were able to change that so that mobility will not be considered a critical ADL, and the person will calculate as an L. And so it'll now calculate correctly for that instance. The other part was about being confined to bed, where a person was, it didn't show as a mobility dependency, and it should show as mobility dependency, and now it does. So those two issues surrounding mobility were fixed in production.
Okay. Thank you very much.
Yeah, thank you. Okay, Jennifer Knudsen. Hi, Jennifer.
Hi.
We can hear you.
Perfect. We're looking in the training zone and we can't find where the actual level 1 form is, so we were wondering where that is. We can
The
only
over one. Mm-hmm.
Yep.
It doesn't exist in your current training zone.
Okay, that was our only question.
Yep.
Thank you.
Yep.
Okay, Jessica Mickelson. Oh. So Jessica, you're unmuted.
Oh, hi, sorry. I just had a quick question. So the 6791D, the support plan signature sheet, can we still just use the paper copy of that until it's fully functional and either attach it in our current, system that we use for keeping documents or attach it as an attachment in revision until it's fully functional? And also going back to the earlier issue regarding initial assessors needing to complete the support plan for PCA or CFSS folks, because they wouldn't know that necessarily ahead of time, but we currently do include the support plan signature page with our initial assessment paperwork in the event that the person does go on PCA.
Yep. Yeah, no, we hear you loud and clear. Just give us a chance to talk about it and give you some direction. So
okay, so at this point, the direction is we're not supposed to use the paper. I guess I had never heard that we had to switch to just only using the electronic signature sheet. And I believe some of the information we've received from some of the health plans is that we could still use it, the paper format for like HR.
The paper version is still going to be available to you. It's not going away with launch, but we just need to have some more conversation about what happens at an initial assessment in the scenario that you're describing, just to make sure that we have all our bases covered before we communicate something out. We just haven't had that conversation yet. So
okay,
I'll just
all right,
bring it back to you, but okay, thank you.
So
okay, Leah. Oh, sorry.
So Beth, we can take one more and then we will need to close this webinar.
Oh gosh, 12. We only have one question left. So Leah.
This is a perfect last question anyways. Will the updated PDF or the PowerPoint be posted out with the archive, since this is different than the one that was sent to us this morning?
So there are what, 3 that are different. Mary's update, the e-list update. I can work to submit and request that additional slides be inserted in. I don't know how quickly it will occur, but
That's
know
fine.
that because the recording is visual, right? You'll at least be able to see it as part of the recording.
Right. Just to have the same PDF available is nice for those of us that kind of keep them all together.
Yep, understandable.
Thank you so much. Have a great day.
Yep, you too.
Thank you.
So
just one more update. We have a lot of questions in chat or in the Q&A, and just know that we'll take those back and we'll address them as we can. But thank you all for speaking up when or raising your hand as well. So we were able to get to all of those questions today.
Great. So again, to listen to past webinars, you go ahead and go to the Disability Training Archive page. When you click on MnCHOICES, you'll see a link to the PDF and you'll see the recording, which will be the visual recording and the audio together, as well as it's closed captioned, so you'll have that available to you. And this is just terminology I always have at the end of every piece, at the end of every PowerPoint, so you have them kind of as your definitions in the background. And so we just want to take a moment to say thank you. Thank you today for this conversation. We look forward to our next conversations. Please remember you can always go out to the County Link page to the MnCHOICES revision project for when the next calls are, when the next webinars are all listed in that page as well. So we will talk to you later. Have a really great day, and we look forward to our next conversation. Mung, you can go ahead and end the recording.